Hey, good morning, everyone. This is Tony at OSPI. We're going to begin in just a moment. First, we do want to quickly go over, or actually not go over, just do a quick sound check. And if you can hear me, I just ask that you use the chat. Just type a quick Y or yes in there. That'll let us know our signal's getting out and sounds good. Look for those. Hey, there they are coming in. Excellent. I appreciate that. Also, the first page of our PowerPoint presentation should now be viewable on your screen. If that's not true for you, or you have audio problems or any other technical problems, again, just send a note to that chat. We'll attempt to take care of anything that may arise, but it looks like we're good to go. Appreciate the feedback for the test. So we're going to pause for just a moment, come right back on and begin.
Hello, everybody. Thank you for taking time out of your busy schedules, especially on short notice, to join us today for our open enrollment check-in. HCA would like to take the time today to review some open enrollment statistics with you. We also want to go over some known user questions with SEBB My Account, and we're also going to save plenty of time at the end of this webinar to do a Q&A session in which we can answer your questions directly. So with that said, let's go ahead and launch right into this. So some general housekeeping for the webinar. Please type your questions in the chat box of the Zoom webinar. I think most of you know how this works by now. We're going to be monitoring that real time throughout the webinar to answer your questions directly. We're also going to be recording this webinar, including the chat forum. So if you don't get your questions answered in this webinar, don't fret. We will follow up with you either on an individual basis or through FAQs after this to make sure that we get your questions answered. And we're also going to be sending out a recording of this webinar and all meeting materials after this to the audience of this. So with that, I'm going to go ahead and launch into some team introductions. Here in the room with me, I have Katrina Pitch, the lead business analyst on SEBB My Account. This is Matthew Toney, strategic plan project manager. We also have John Bowden in the room, the manager of the SEBB section. We have Sarah Stewart, SEBB project coordinator. Jesse Polsbo, our outreach and training manager, and Rochelle Andrake, our manager of SEBB communications. So with that, I'm going to go ahead and hand it over to Katrina Pitch, our SEBB business analyst, to start going over some SEBB open enrollment statistics. Go ahead, Katrina.
Good morning. So we wanted to give you guys a little bit of an overview of where we are at to date. We have received over 146,000 reported eligible SEBB employees. Of that portion, 93,000 approximately have signed into SEBB My Account and successfully claimed their SEBB record. Nearly 62,000, 42% of the eligible employees have completed or waived their enrollment. So we do have over 50% that have still not yet completed their benefit elections. So we're looking to get a little bit of feedback from you guys today to maybe provide some insight as to why we have maybe slower enrollment and talk about some of the things that we're doing to communicate out. So for dependent verification, we expect approximately 156,711 dependents. Currently, we have received 111,000 approximate dependent verification requests. What you see here breaks down the requests that are in approved, pending, and denied status. The documents, the dependent verifications that we have received with documents are the ones that we can do here in-house at HCA, along with the benefits administrators in the field. The amount that we have the amount of verifications we have received without any documents is 16,390. These are requests that we cannot complete. We're not sure, in some cases, I'm sure folks are bringing in physical documents to their benefits administrators, and hopefully we can close that gap over the next 2 weeks. We are sending out communications to remind people if they have a dependent verification request submitted and have not provided documentation, that they need to do so. Also, folks that have received a denial at this point will receive a letter to prompt them to provide additional documentation before the end of open enrollment. For COBRA data, we have 138 districts that reported COBRA eligible folks. 167 districts have not reported. Rochelle, can you give them a little bit of a recap on where we're at with COBRA communications to those eligible folks?
Yes. So anybody who has reported their COBRA data to HCA at this time, they have been sent a COBRA packet that includes information on how to enroll in continuation coverage. The majority of those went out on the 9th of October, and then there was another mailing that just happened last week as well for another 300 or so enrollees. So as we receive the data, we are trying to send information out every 2 weeks. We're doing a bulk mailing of those. So the next one should go out the week of November 4th.
Thank you. Next, we wanted to talk about some of the common questions that we're receiving from subscribers and maybe some of the challenges that they've been experiencing. So one of the common questions or concerns we have is that folks can't upload documents for their dependent. So one, we want to ensure that they're using Chrome. They also need to ensure that they're checking the box next to their dependent's name as to who that documentation is applicable to, and then keep the file size to 6 megabytes or less. We had been receiving a couple of reports that folks were attempting to upload documents as big as 4 megabytes and having some issues, so we have corrected that, and now that should no longer pose a problem.
And that was as of last night, so
Yes, as
we
of
tried
last
yesterday,
night.
try again today.
Yep. And an additional question, it doesn't look like I've enrolled in coverage after I made elections. So to ensure that the elections saved and were appropriate, they can be viewed under Coverage Elections tab. It shows elections made for this coming year's coverage. Coverage Summary tab will display the coverage that is currently in effect and will not be populated with data until January 1st of 2020. So we have included a message on the coverage summary page to redirect folks looking for their current elections to the appropriate tab. And another question, why was my dependent denied? Documents that were provided did not meet the eligibility criteria. So we encourage them to review their eligibility, the eligibility criteria for SEBB, and provide additional or missing documentation that proves that they meet the criteria. They can do that in SEBB My Account, or they can provide that documentation to a benefit administrator, and with the appropriate documentation, the benefit administrator can overturn a denied to an approved status. My dependent hasn't been verified yet. When can I expect my dependent to be verified? We are working diligently, as well as are a number of benefits admins at districts, to verify the current pending dependent verifications. We have been able to complete 75% of those received requests that had accompanying documentation in SEBB My Account. We will continue to process new requests as they come in and work through the requests that we have received to date. The dependent verification process for benefits administrators. So just to recap, an employee can submit a document through SEBB My Account with an upload, or the employee can present their documentation directly to a benefits administrator. There is no need at that point for the benefits administrator to upload documentation into SEBB My Account if they have viewed it and it's appropriate. you can go ahead and complete the verification at that time. It's probably even a little faster than uploading that document and having HCA complete it in a queue. The valid document list is provided in SEBB My Account via several different links. The links are available in the Upload Document tab. They're available in the Dependent tab. And there's also a reminder when at the end of adding a new dependent that they can check the SEBB eligibility requirements to make sure that they have, they can provide appropriate documentation. Children can be verified and added to coverage through the last day of their 26th birthday. So keep that in mind. Anybody over the age of 26 as a child dependent would need to qualify as a disabled dependent. Must be uploaded or presented to benefits administrator by the last day of open enrollment. That would be the dependent verification documents. So if we do not have those by November 15th, we will not be able to verify those dependents. HCA is assisting SEBB organizations with dependent verifications for this first annual open enrollment only. After open enrollment, it will be the responsibility of the district's benefits admins to continue the verification process. So I'm going to hand it back over to Matthew.
Yeah, so before moving on, I would like to just sort of take this moment to ask the benefit administrators out there if you have any questions about the data that we have shared pertaining to open enrollment before we move on to discussing the default option of subscribers do not enroll. So if
Looks
you
like
could...
we do have several questions already here in the chat. The first one is from Kim Simon. We have employees who can't see their dependents have been verified even after we verified them. Why is that?
That is actually a known issue for a couple of, or a select few subscribers. We are looking into what the cause of that is, but as long as you see them as verified on your end, they are indeed verified, but appears to be a display issue in a couple of instances. So we are digging into what the root cause of that is.
And if you have specific instances, you can email those to us. There's an email address at the end of the presentation that we'll share it rather than reading it out. Kristen Hessen is asking, can we get socials added to all the reports? Having just first and last names make it difficult to identify staff since we have many duplicates.
Yes, we are going to go ahead and include the last 4 digits of the Social Security number to a majority of the reports, and that is in the queue for an enhancement.
Let's see, our next one is Andrea is asking, if an employee's document is denied and they upload something new, does it change their status back to pending?
It sure does. As long as they upload that document before midnight on the 15th of November, it will put them back in a pending status.
Okay. Cindy is asking, if dependent verification is uploaded by 11:15 and then denied after that, will the employee still have another opportunity to upload more documents?
Jesse, do you want to speak to that?
Yes. So the short answer is yes. Any DV that is received prior to 11:15 but verified and denied after will have an opportunity to provide additional information even if we go beyond the 11:15 open enrollment window. More details will follow on that, and I think we're going to be pushing out some of our first messaging this Friday, correct, Rochelle?
Yeah. Okay. Jessica's asking, if an employee submits a 2018 tax return, why would one dependent be approved and others show as pending? Employees are very concerned that some are approved and others not.
So that could be related to the first issue or the first question that was posed, that somebody is approved on the benefits admin side but shows pending on the subscriber side. So it could be attributed to that, or possibly if the dependent verification requests were done at different times, that's a possibility. But again, if you have a specific instance that you'd like us to look into, then please follow up with either a fuse or an email into the HCA SEBB IT support.
Could it also be that the dependents were just verified at different?
Not if they showed up as pending.
Oh, okay. Debbie is asking, can we get a copy of this presentation emailed to us? Yes, we are going to be providing that to everyone that received the email for this invite. If you did not receive the email for this invite and were forwarded it to us, please go ahead and put your email address in the chat room. We'll be sure and get you added. Otherwise, everyone that was invited will get this. The next question is from Chris. I have an employee that has a disabled child older than 26 and brought the SSI form. Is there something else he needs to provide or upload?
Jesse, do you want to?
Now with disabled dependents.
Let's go ahead and we'll have to respond back to you individually to review the documentation that is necessary for a disabled dependent.
Carla is asking, how long will we have to verify dependents if they turn in documents on November 15th?
So I believe the guidance that we're working on right now is if you have dependent verification that's on your desk, the deadline will be the 22nd of November. And more guidance is going to come out officially for that. But in the meetings that I've been sitting on, it looks like the 22nd is going to be the time for benefits administrators to clear any pending dependent verification that they have on their desk.
Okay. Taylor is asking, if someone uploads an incorrect document to SEBB My Account, is there a way to remove it from SEBB My Account?
We are working on that functionality. So we will have that available soon to where if the incorrect document is uploaded prior to approval or denial, they would be able to delete. Otherwise, the current workaround would be to delete the dependent altogether that document was assigned to and re-enter the dependent. But we are working on that fix to allow people to remove, if you accidentally upload your Costco receipt instead of the birth certificate. We do want to be able to provide that functionality to you.
And they can upload multiple documents to each dependent too, right?
Yep, you can upload multiple documents to each dependent. An example, marriage requires more than just a marriage certificate. So,
Joan is asking, what's the best way to know if employees have successfully enrolled? The benefits election report doesn't seem to be accurate.
We have a task in currently to resolve any of the data anomalies that are in the benefit election status report, but that will be your go-to report to see who in your organization has completed their benefit elections.
Okay. Lorianne is asking, can ineligible employees be removed from the employees without login reports?
We will have to take a look at that.
Laura's asking, I've had employees' original documents denied and then bring incorrect documentation, but I can't change to verified after they are denied. Laura Jensen.
Laura, we'll look into that because you should be able to update a previously denied status to approved.
Okay. Beverly said that she would like the full SSN. I believe she must be referring to the reports.
We'll have to look into that. It's generally not recommended to include a full SSN in an exportable report. But we will circle back with our internal folks and data governance privacy to see what the feedback would be on including full 9 of the social.
Oh, and Lorianne just added to the chat, Laura, you have to move them back to pending by updating the managed dependents. So hopefully that helps, Laura. Thank you, Lorianne. Wow, we got a lot of questions here. Nicole is asking, what birth sex should be listed for a transgender dependent child? The gender listed on the original birth certificate or the gender on the new certificate?
So what we recommend, we have asked for birth sex to be reported. And in some cases, folks even have their birth certificates updated to reflect a different sex than what they were born with. That is certainly up to them. This is a self-reported piece of data. We do recommend birth sex, such as in the event that somebody that was born female and has transitioned to male, if you go in and need a hysterectomy and you're listed as male, you could run the risk of it not being approved. But that would be something then at that point that you would discuss directly with the carrier.
Okay. Kelly asks, if we receive the dependent verification documents in our office by November 15th, but have not had time to complete the verification online by the 15th, will we have time to complete them after the 15th without the employee being penalized or their dependent not being covered?
Yep. Yeah, Jesse, you had mentioned earlier that that dependent verification received in paper form at the district can be reviewed by November 22nd.
Okay. Excuse me. Laura is asking, is it possible to display which employees have attached dependent verification docs so we don't have to click through each employee?
Yes, we do have that listed as an enhancement request. It's currently not functionality that's available, but we understand that that would be beneficial. So we do have that in our queue of work items.
Lindsay asks, how strict will SEBB be with making any changes after November 15th?
John?
Repeat that again, please.
How strict will SEBB be with making any changes after November 15th?
It would depend on the type of changes. If we're talking a dependent verification, that would, within that, prior to November 22nd, those could be made.
Or perhaps a special open enrollment?
Right, okay. If it's a special enrollment, then I believe it's 60 days from the special enrollment event occurring. So there's added time there, but if it's just part of the regular open enrollment, additional documents, et cetera, up until November 22nd. That's not adding dependents that hadn't been added previously or changing benefit selection.
Kristen asks, we have found that staff can list their spouse and double cover them. Both are SEBB eligible and the system will let them. Will that be fixed?
So we do understand that there are partners within SEBB organizations and perhaps they want to all be covered underneath one plan for their medical. So in that case, they should be waiving their, so one of the spouses should be waiving their medical coverage. They will continue to be covered for dental and vision on the account that they are a subscriber on, and the account that they are dependent on, they should waive the dental and vision. You truly are not allowed to have double coverage. And so the system is currently allowing for it to appear as if that's possible, but we will be running reports to clean that up and ensure folks aren't actually listed for double coverage for the same type of benefit.
Brenda asks, can you briefly describe the process for staff who elect to take supplemental long-term disability? Will the district determine the premiums based on gross pay, process the deduction, and then report that to SEBB?
Can you repeat the question again?
Can you briefly describe the process for staff who elect to take supplemental long-term disability? Will the district determine the premiums based on gross pay, process the deduction, and then report that to SEBB?
Yes, so, well, mostly in part. The subscriber can elect for supplemental LTD through SEBB My Account or through a paper enrollment form. Through SEBB My Account, it's just one option. You click on the radio button under supplemental LTD coverage to say I elect for this coverage. Then that rate that applies to that particular subscriber for LTD will be included in the billing file that is sent to you on a monthly basis. That rate is what you would apply towards the gross wages. And then there is a report that you complete at the end, and that is sent directly to the standard along with payment.
Okay.
Kristen asks, when will enhancement for adding socials be completed in the report step?
I'm looking at that right now. Can't find that right now, but
maybe in the chat, if folks could respond back and let us know how beneficial that would be, if that would give us some additional weight in being able to see how many different organizations this would positively impact with a change sooner versus later.
There's a question from Debbie pertaining to family medical leave. They currently pay their district for their portion of benefits. How will this work for SEBB?
The paid family medical leave continues the same way. That's separate from the SEBB program. So both employer and employee continue to contribute as they are now.
And regular family medical leave, is it PFMLA or just FMLA that they're talking about?
It is.
Thought I heard paid.
It's paid
Okay.
family medical leave. Yep.
So that's a short-term disability function. We sent out guidance on short-term disability last week.
That guidance pertained to if there's a collective bargaining agreement where employees are not contributing currently to the paid family medical leave. So it was specific to CBAs and the district not participating in paid family medical leave at this time.
Nicole is asking questions pertaining to dependent verification and it being slow to confirm or save once the upload the documents. She's asking if that's a known issue with slowness.
Slowness in uploading the document or verifying the document?
We're trying to do some dependent verifications here, but finding it very slow to confirm or save. We're waiting multiple minutes for it to take. Is that a known issue?
No, that is not a known issue. So if you could let us know like particular instances in which this happens and how long it is taking for it to save, that would be helpful.
And also what browser you're using, because that does make a difference.
Right, yeah.
Chrome is our preferred browser. Just seems to work with everything.
We sent out some troubleshooting guidance on that yesterday in the SEBB update as well.
Lelena is asking, how is SEBB going to determine if employees who choose to waive medical did so for one of the 3 allowable reasons?
We are not policing, we are not asking for documentation at this time for a subscriber that has elected to waive their coverage.
The only thing with employees that choose to waive is if for some reason they decide that they do need to have SEBB coverage later, they will need proof of coverage while they waived, when they waived.
That's true.
Kelly is asking a question pertaining to employees who were originally eligible but are no longer eligible at the district. Kelly's trying to terminate their eligibility within SEBB My Account, and Kelly is saying that she submitted that through Fuse a couple of times and hasn't reached anybody. How would she do it in SEBB My Account?
Okay, Kelly, we'll follow up with your Fuse request, but what typically happens is to terminate an employee. You first search for the employee and under the Manage Subscribers tab. And then once you locate them, you would select the Employment tab. And on that Employment tab towards the bottom, there's an opportunity to either transfer them out or terminate them. So if they do not, if you're utilizing the termination point and it's not working, please let us know who it isn't working for. If that's included in your original Fuse, then I'll follow up with you individually and just make sure that we troubleshoot that with you and get that resolved.
We have a question from Heather pertaining to dependent verification. She's saying that she has an employee that 2 of her dependents are verified and 2 of her dependents are listed as pending. However, when Heather goes into the dependent verification tab to manually verify the 2 pending dependents, she can't find the employee listed.
So to find folks that, so it sounds like this might be a symptom of the earlier reported issue where somebody has been already approved and it's not showing for the subscriber that they have an approved dependent. But you can see previous approval or denials by unchecking the box under the dependent verification tab to see only pending requests so that it will show you all 3 request type pending, verified, and denied.
Okay. Andrea is asking, I have a few people who are termed from benefits in error and can't figure out how to reactivate them. Adding them again just puts in a duplicate record.
Andrea, we could follow up individually on that as well. So as long as the eligibility timeframe is not overlapping, that is what we would expect, is to have an additional new record.
Okay. Chris says in the dependent verification area, it doesn't keep its sort function. I sorted by last name, then when I verify one person, the sorting goes away. If that could be fixed in there as well.
Yep, we have that listed as a task.
Olga asks, I have an employee that has his wife, which is also a SEBB eligible employee, waived her medical in her district, and my employee added her onto his SEBB insurance and did the spousal surcharge calculator and won't have to pay the $50 spousal surcharge. Is this correct?
Yeah, they're both SEBB employees, so one SEBB employee can waive and there's no surcharge.
Okay. Nicole says, I have 3 employees that ended up in the SOE verification area. How do I get them moved?
So in that case, we would deny their special open enrollment request and then encourage them to follow the open enrollment process with the stepper at the top of the screen. That should take them through the appropriate selections for OE currently underway.
And we did add a banner on the SOE section to let people know that they can't submit those until after open enrollment too, to prevent more of those.
Well, and it's not that they can't submit, it's that we're encouraging them not to.
Right. Kathy says if someone attests they are waiving because they have other group insurance, but they actually have Apple coverage, will there be a cross-check at SEBB for that?
I believe we're going to be running SEBB enrollments against Apple Health.
Yeah.
Enrollments.
They'll receive information from the Apple Health program if there's a discrepancy.
Okay. Nicole says, I have an employee that has 2 accounts in SEBB. I tried to terminate one, but it's still there. How can I get rid of one of them, and how does she know which one to choose?
Nicole?
Yeah.
From what?
I'm curious if that was the same SSN or not.
Okay, we'll take a look. Nicole, which district are you from?
Let's see. We might be able to look her. Bremerton.
Okay.
Okay, Laura asks, if an employee is defaulted into coverage, can they update their smoking attestation status outside the next open enrollment period without a special open enrollment event?
Yes.
Yes.
Okay, that's an easy one. How does this, Tammy asks, how does the standard know how much the employee gross salary for supplemental LTD is prior to the first billing districts received?
The first billing file. So the billing file we provide to districts is available, I think no later than December, is it 15th or 16th?
I'm not sure that 15th or 16th.
15th or 16th, at the latest, you will have your billing file. That billing file will include the rate to apply to the subscriber's account. The payment is due to the standard on the 1st of January, so it'll have that time frame in order to calculate and report to standard what that deduction is going to be.
Okay. Carla asks, if the LTD rates are based on monthly gross wages, will this fluctuate monthly based on additional hours possibly worked?
Yes. That is why we are providing you a percentage rate instead of asking for like a one-time monthly salary amount. So it will be up to the districts to apply on actual gross salary.
Okay. Lindsay asks, I'm having the same issue with saving documents. She's using Chrome. Okay.
I think there's quite a few of them confirming that they're having problems with uploading dependent verification documents and it being slow. So
we'll have to take a look at that. It could be the size of the document. Oftentimes too, it's really dependent upon the Wi-Fi connection, if they're not on a wired connection. So definitely happy to take a look at some of these instances, but we want to make sure that when folks are uploading a document, I've had reports that they aren't able to upload a dependent document, and then in investigation, we find that they haven't added a dependent yet. So the first step is to make sure that they've actually added a dependent. Second step is to select the document from the device they're using. Make sure to pick from the drop-down what type of document it is that they're uploading, and then apply that document to one or more dependents. Documents such as tax returns can be applied to multiple dependents, and then ensure that you submit or confirm changes, and that should save without an issue.
Kelly says that terminations and employees transferring to a different district is not working. There have been several instances where the employee is termed on the old district but can't be added to the new district.
So in times where I've seen this happen, where somebody is termed in a previous district and trying to be picked up by the new district is using a date that overlaps with the previous district's eligibility date. So
A person can't be eligible in both districts.
yeah, we can't have overlapping eligibility. So we can take a look at that and figure out if you have an instance where you're using a date post the date that the employee was terminated in the old district, then we would want to hear about that and try and troubleshoot that issue.
Okay. Kim asks if an employee is adding their spouse only to dental and vision, do they still have to attest to smoking?
No, they don't. The smoking attestation is only for medical coverage.
So the system will show the attestation, and so if they're using SEBB My Account, they will need to complete the attestation in order to move on to the benefit elections. But either way, it will not apply if they are not adding them to their medical coverage.
Lorian has a question about having terminated a record, but having a second record on the same employee because she was rehired. SEBB My Account, when she attempts to sign in, says that she has a duplicate record and they need to fix this, but they don't know how.
Okay, so can you have, Lori, can you please send us a message in Fuse to get this resolved?
Stephanie has a question. Am I not able to verify extended dependents? I have 2 employees with extended dependents who have documents uploaded. They are pending in status, but there are no verify buttons available to me.
Did they fill out the extended dependent certification
so
form?
The extended dependents and disabled dependents are verified by healthcare authority only, because we'll need to review the court-ordered plan for extended dependents, and then for disabled dependents, they have to review the certification of disabled dependent form.
Heather is asking a question about MetLife. She's saying the bottom of the MetLife paper enrollment form says to return to your district's benefit specialist. Am I submitting these to MetLife somehow? I believe she's talking about the paper enrollment for probably supplemental life.
I think we're gonna have to follow up with you on that one because I haven't seen the form myself. And there's different districts that are, some districts, the largest districts in the state were given the opportunity by MetLife to do a direct billing. And so it kind of depends on which district it is. Otherwise, it's very likely that the subscriber should be sending that directly to MetLife, but.
Yeah, Heather, we can follow up on that and make sure we understand what's on the form and how to guide you through that. Kim is asking, if an employee is hired on November 5th, does it create an open enrollment period for them? If so, what is their deadline to enroll?
So if they were hired on November 5th, they basically fall into a newly eligible, and so they will have 31 days in order to make benefits elections.
Tammy is asking if an employee waives medical because they are enrolled under Apple Health. When HCA discovers they should have enrolled in medical with their district, will they be automatically defaulted or will they get a chance to enroll?
I believe they get a chance to enroll. It's a special open enrollment event because the coverage that they have currently is expired. They no longer have it.
And it's possible that if they have Apple Health at no deductible, no cost, then they aren't required to utilize SEBB coverage. Is that correct?
That I'm not sure of. I think the piece was that they would, but there may be some subsidies on the premium. It's a case-by-case kind of answer.
Carl is asking about LTD coverage. If the premium fluctuates with gross wages, how will they determine what wage to base their disability payment on?
So they should be applying it to their payroll, amounts each month.
That's
I think Carla's assuming that maybe their payment amount on each month fluctuates due to maybe variable hours, I'm interpreting.
yeah, the percentage that they're supplied applies to the gross. So the percentage stays the same.
Shannon has a question about employees being attached to another district. We've requested for those districts to release them. We have been advised that they have been released, but when we go into SEBB My Account to register them on our side, they're still attached to the other district. Is there anything we can do to register those employees?
So if you're not reporting with overlapping eligibility dates, then please send us that particular instance and views, and we will investigate that accordingly.
Laura is asking a question. If we originally uploaded employees as eligible, but they're not eligible due to hours worked, do we still mark them as termed, or do we just change the anticipated 630 hours to no? I had changed anticipated 630 to no, but the employee is still receiving mailings about enrollment, which...
Changing somebody to 630 hours anticipated no indicates that they are now not SEBB eligible, but continue to be locally eligible. And only those districts that have submitted a collective bargaining agreement to HCA, indicating that they would be providing locally eligible benefits, are the only districts that should be reporting employees as 630 no. But if they are truly no longer eligible for SEBB benefits at all, then you should be terminating their eligibility.
Regina has a question about retired employees that are on PEB/Medicare, but they're eligible for SEBB. Do they waive SEBB coverage due to that eligibility under Medicare and PEB?
If they're eligible under SEBB, they would have a choice. They could either waive SEBB and stay under PEB retirement, or they could defer the PEB retirement and take the SEBB benefits.
Patty is asking, what is the wait time around Fuse getting back to us?
So the yearly goal for us is 24 business hours, which if you spread across work days is about 3 work days that our team tries to respond back. Now that's across the year. We understand that open enrollment is kind of a peak time where we're going to receive hundreds of fuses a day, so there may be a little bit of extra patience we ask for as we work through the open enrollment waves, but eventually it settles down and we get most of them answered within three business days.
We have a good number of people working on that.
Right. We basically doubled our staff as well to address fuses online.
Lelena's reporting that they're still having issues with subscribers reporting the name of their beneficiaries on their MetLife coverage. Is this still being worked on?
So we did just receive guidance from leadership to add language to the coverage elections page to remind folks, or really inform folks to create an account at MetLife to designate their beneficiary, or they can get a form from MetLife to designate their beneficiary.
Carla has a question pertaining to LTD. When an employee is using their LTD and receiving the benefit, what wage will they base their payment on if they're possibly paying on a different premium each month?
I think she's following up on her previous question.
I was wondering the same thing as that question came in before, if there's a lot of variation. I believe it would be based on the month for which the last month for which the premium was paid, but we'd need to check with the standard to find out the answer.
Okay, so we are officially caught up in the questions. Thank you so much for all of those. We're going to go ahead and continue roll very quickly through the rest of the presentation, and then anytime we have left over, we are going to continue answering the questions in the chat. So John, I'm going to go ahead and hand it off to you to describe the default and subscriber enrollment.
All righty, thanks, Matthew. In the open enrollment period, we've had 28 days go by, including today. We have 17 more days. And you've been hearing numbers about those that have claimed. About 93,000 have claimed their SEBB My Account. That's 64%, but we still have 53,000 that haven't, about 36%. And one of the things we want to make sure is that people have claimed their account. It may take them a little while to make their benefit selection, and so we'd at least like to get those claimed as quickly as we can. Now, of employees that have made the benefit selections, Trina showed you that we had about 62,000 that have made benefit selections, about 42%. So we have about 85,000 employees out there that have not yet made a benefit selection, about 58% of the employees. And if they don't make a benefit selection or waive benefits, they will be defaulted into the UMP Achieve 1, and they will have a payroll deduction of $33 a month. Plus, they will have the $25 a month surcharge for tobacco usage. So if they don't do anything, $58 a month on the payroll deduction, and any dependents that they might have and wish to have covered will not be included. So want to make sure that they do make benefit selections. Now, they are defaulted into the UMP Achieve 1. They're also defaulted into the Uniform Dental Plan, MetLife Vision, and they'll have both the basic life and long-term disability. So one of the big areas in particular, we've had a lot of conversation around dependents. Right now, we think that there's probably about 45,000 dependents still to be added, about 29% of what we anticipate. And we have about 16,000 dependents with documents that have been uploaded that are still pending. The big message here is we've had a lot of conversation around some difficulties making sure dependents are in there and verified, documents uploaded, et cetera. And in the 17 days to the end of open enrollment, we're strongly encouraging people not to come flooding in at the very end, because as we try to work through some of these difficulties, we don't want to have a real logjam occurring. So please do encourage employees to go claim their SEBB My Account and to make the benefit selection. We did send a postcard out last week. It was based on people that had not made a benefit selection as of October 21st. So folks that have done it, claimed their SEBB My Account or done their selection since the 21st, we appreciate that, but please do encourage any that you are seeing that have not claimed or made benefit selections to do so as quickly as possible.
Jesse, would you like to go over some open enrollment resources that we have available?
Sure. So with the 7-person benefits fairs, we've completed 19 of the 20 fairs already. The only outlier is going to be Pullman on November 7th. The benefits fairs, we weren't sure what we were going to expect when we came into these. We were very pleasantly surprised. More than double the population we were forecasting has shown up to these benefits fairs. We're around 10,000 people total. So we plussed up the amount of staff representing SEBB on our side. We brought in extra vendors and we created new materials to help better answer questions for the employees. This was really kind of our only opportunity where we're face-to-face with the employees, so it was nice to hear their questions and concerns directly, mostly about plan availability, premiums, how to choose the health plan, dual enrollment, online enrollment questions, a lot of the same questions we're hearing today. Now, as we move out of the in-person benefits fairs, it'd be a good time to mention the virtual benefits fair, which is still available to members, and that's 24/7. They can go online. Contains all the same information, the materials and information and it's also an excellent supplemental resource for BAs to provide to their employees if they're looking to get more knowledge about the benefits that are available to them. Currently, the virtual benefits fair is being accessed primarily directly and through GovDelivery hyperlinks, but we're starting to see a growing population of folks accessing the site through links that are provided on school district web pages, which is excellent because it gets more exposure and offers the availability to more employees. And the VBF is going to remain up and functioning even after open enrollment. So it's going to serve employees that will be going through special open enrollments as well. Alex, another great resource for explaining the benefits in language that avoids a lot of the insurance jargon. It takes the input from the member and provides the recommendations based on their own individual preferences and life circumstances. Just one caveat is that Alex doesn't actually enroll the subscriber into the benefits it recommends. So just some people were under the impression that once it gave the recommendation that they were enrolled. So just to make sure that if we're recommending it, it is only a recommendation advisor tool. Where we initially started the benefits administrator webpage to assist benefits administrators with information prior to open enrollment, that is starting to get a little cumbersome with all of the information that we're pushing out. And so we are in the process of transitioning the BA web page to the BA website, which is going to have a lot more space, and it's going to be spread out a little more intuitively so that people can reference information not on a single long page. And then this will be the steady state site where benefits administrators can go to obtain resources and information. We talked a little bit about Fuse as well. Fuse, just continue to send us our fuses. If you're not getting a response immediately, just know we're trying to work out everything within 3 days. As open enrollment starts to wind down, the number of fuses will go down as well, and we can get to you much quicker. We also have the dedicated number for the benefits administrators to call. Gov deliveries. I know you guys have been receiving a ton of Gov deliveries sort of in random fashion as we send it out, and that's just to get you important information as soon as we receive it. Communications is going to speak a little bit here in a second about how we're going to streamline that. And then we also provide the technical support contact center. So if both benefits administrators benefits administrators can come to us, but if employees have questions about SEBB My Account, they can reach out to the technical support center to get some of their issues addressed. That was pretty quick, but
Yeah, it was perfect.
And Matthew, when we send this out, can you add the 1-855 number?
It's at the end.
It's at
Yeah.
the end.
It's at the
Good.
very end.
Good.
Rochelle, do you want to cover some upcoming communications that the benefit administrators can look forward to?
Yes, sir. So we began sending SEBB updates again on October 25th in an attempt to streamline the many messages you've been receiving from us this month. And we'll continue sending those updates on Tuesdays and Fridays throughout open enrollment. The latest one just went out yesterday, so make sure to check your email from that. It does come from the SEBB program, not outreach and training. One of the messages that will go out in this Friday's update is an ask to use your organization's automated voice messaging system or robocalls to reach out to employees and remind them to take action during open enrollment. So we will provide a sample message for use in that Gov delivery message, and the goal is for employees to receive a call to action from a familiar source rather than from HCA, who they might not be as familiar with the postcards and mailings and whatnot. So the more that they can hear from you instead of us is better encouragement that yes, this does apply to you and you do need to take action. We're also going to start sending dependent verification letters to let employees know whether their documents were approved or denied. The approval letters will begin going out next week and will run daily as approvals are received as they're processed. We're also going to do a mailing this Friday requesting more information for those who've been denied so far so that they can have an opportunity to correct their verification before November 15th. The dependent verification denial letters, when they are officially denied, and cannot resubmit, those won't go out until after open enrollment ends. Also after open enrollment, we'll send confirmation letters to confirm benefit elections for medical, dental, and vision. And those should go out in early December. This will be around the same time that employees should begin receiving communications from the plans that they've elected, such as welcome letters and ID cards.
So I just want to take a second here. There is some data that the management team of the SEBB program is seeking from you as benefit administrators because you know the employees best at your school districts. This data from these questions that we're asking you is going to help us sort of determine how we should communicate, how better we can support, because we are looking at decreased enrollment from what we had anticipated we might see because we're 2/3 of the way through open enrollment. So if you could do us a favor and restate the question within the chat box and then answer the question, we're going to review this data in our daily stand-ups that we have, and hopefully this will help us to determine how best we can support you and your employees throughout open enrollment. That would be hugely helpful if you could restate the question and then answer the question with whatever you think the primary reason is for pertaining to these questions. And with that, I'm going to go ahead and just launch directly back into some questions that we're receiving until 11 o'clock. We have 3 minutes left.
And we have the last screen, which has contact information, I believe.
Yes, the last screen does have contact information, so make sure to use that.
And we do have the HCA SEBB IT support email on there, but for benefit administrators, your direct line is through Fuse. So mostly we've set up that inbox for IT-related problems. So, okay.
Okay.
Oh, looks like we have time for a couple more. Are we? Connie asked, we have an employee who is currently on paid leave under FMLA, but will most likely be taking unpaid leave for the remainder of the year starting in January. Who do I contact regarding continuation coverage when an employee has exhausted paid leave but wants to continue benefits?
So she would send that data to the to outreach and training through Fuse. That's the data requests that we sent it out. It was a while back, and Amy's going to send another one out in early December. But just send a Fuse with the employee's information, and they should be able to give you information about how to get that into the queue to receive a continuation coverage packet.
Okay.
Beverly has a question. Is there a code on the benefit elections report that indicates waived medical?
Waived medical is ZS. We are going to be updating the reports to not display codes, because I know that's a little confusing, and to do an example, the dependent verification status report displays statuses as of like D and I and R, and without a key to those values, that can be a little confusing. So we're going to change those to things like denied, illegible, and pending, and the verified statuses. So we will get those updated along with including plan names in lieu of plan codes on those reports.
Kathy has a question. Does Alex basically compare based on cost? And Kathy, I know the answer to that question. Alex primarily focuses on cost of the plan. It will not recommend plans to you if it's outside of the geographic region that you live. But yes, the primary sort function on Alex for when it's recommending plans is based upon cost.
And I just want to add to that, at the benefit fairs we've been doing, because I get that question quite a bit, I stress the importance of checking provider networks to make sure that if you have a provider that you particularly want to keep, to look at the networks to make sure your provider is there, or that you have enough time if you need to find a new provider for the plans available.
And we are actually out of time. Thank you, everybody, for joining us today. I'm going to keep the chat box running and also the questions up on the screen. Once again, it would be hugely helpful to hear from you and your perspective pertaining to these questions that will help us communicate and support you better. But we're going to go ahead and log off. We have captured all of the questions in the chat box, and we will be sending out the meeting materials and the recording of this webinar to all participants. Once again, on HCA's behalf, I thank everybody for taking the time, and we will chat with you soon.
Thank you.
Thank you.
Thank you.